I'm Dr. Pramitha, specialist in obstetrics and gynecology, Abeer Medical Center, Abu Hamour, Doha. As many of you may be knowing that the month of October is being celebrated as the Breast Cancer Awareness Month everywhere in the world. The main aim of this campaign is to increase the awareness about breast cancer, the detection, the screening, and the need for the early intervention and diagnosis. As per WHO, in 2020, 2.3 million cases of newly detected breast cancers are there, and more than 6 lakhs deaths are attributed towards the death due to breast cancer. What is breast cancer? The abnormal proliferation and growth of breast-specific tissue leads to breast cancer. What are the risk factors? Risk factors can be modifiable or non-modifiable. Non-modifiable are the age, the gender. Both genders are equally affected, but females are more prone for breast cancer. Then the hormonal nature of the patient. Then the genetic family history of the other malignancies or breast cancer. Then coming to the modifiable risk factors, obesity, lack of exercises, addictions like smoking, alcoholism, lack of breastfeeding, infertility, prolonged treatment with hormones like hormone replacement therapy or prolonged use of oral contraceptive pills. Among these risk factors, certain risk advances or increases, for example, age more than 50 years, early menarche less than 10 years, or menopause more than 55 years, family history of other malignancies. These risk increases. So how these breast cancers may present? Usually they present as a mass in the breast. So when I say mass, every mass in the breast is not cancer. There are so many benign conditions in the breast. So a mass to be malignant have some features like it may be very hard, may not be painful always, it may have some fixity to skin, it will be irregular, it causes some changes in the position of the nipple, some skin thickening will be there. Apart from this, there may be some discharge from the nipple apart during the time of lactation, or some skin changes, pain not associated with any menstrual cycle, some swelling in the armpit, skin thickening or changes can be there. So these signs and symptoms in the breast should be noted, not ignored or neglected. So when we see any sort of signs and symptoms we discussed in the breast, what all things we can do, what we are supposed to do. Screening is the best method to detect any changes in the breast early. So when I say screening means we are examining even with the absence of any disease or symptoms. So screening helps in the early detection of any changes in the breast, which includes self-awareness, self-examination of the breast. Breast self-examination is not a replacement for the medical examination or mammography done in a medical field or medical setting. So mammography is the screening method, screening choice for the cancer breast, since mammography can detect even the small changes even before the clinical presentation. Mammography is the imaging modality used for screening the breast cancer. Breast cancer awareness is not just a month. Fighting against breast cancer takes everyone. Every ribbon gives hope, and awareness is power. Thank you.